So welcome everyone for joining us. Sorry for the delay. Thank you for being here with the Bhopal Medical Appeal and all of us and everyone here on this panel for this presentation on Bhopal's endless disaster in the time of COVID-19. And I'm going to get started. My name is Bridget Hanna. I'm going to be hosting. I'm an anthropologist and an independent scholar. I've been involved with Bhopal for a long time. I co-author of the Bhopal Reader, many articles on Bhopal, and I wrote a PhD dissertation on the medical responses to the Bhopal gas disaster. As I'm sure almost all of you know, today marks the 36th anniversary of the Bhopal gas disaster, which was one of the world's worst industrial disasters. And in 1984, while the city of Bhopal was sleeping, the Union Carbide pesticide factory leaked 20 tons of methyl cyanate gas into the sleeping community, exposing over 500,000 people to this incredibly toxic gas and killing many, many thousands. Since then, people have been dealing with chronic health conditions as a result of this. The rates of co-morbidities and all kinds of secondary illnesses, as well as primary illnesses from the gas disaster, continue to be extremely high. And now we have populations suffering as well from multiple secondary effects, including injuries from poisoned water related to the failure to rehabilitate the site in Bhopal, which we're going to hear more about today, creating a toxic environment. We also have second generation effects, which have been very damaging on second and third generation children of people affected by the gas disaster. And now at this point, we also have COVID-19, which is contributing more now to mortality among gas exposed, in part because, as we learned very early in the COVID-19 epidemic, any kind of medical comorbidities or any kind of chronic illness makes you especially vulnerable to dying from COVID-19. And we're going to hear more about that today. So I really appreciate all of you taking the time to join us. This webinar has a number of goals, and I'm really excited about it. First of all, it's really wonderful to actually have this opportunity to do something in a different type of space than we often do for marking the anniversary, and to really bring together healthcare workers on the ground in Bhopal, victims and victim advocates, as well as specialists and advocates and supporters in other countries. So it's really wonderful to be able to have everyone together and to be able to have questions and answers on that. We're also wanting to raise awareness of the continued corporate negligence by Union Carbide and now Dow Chemical, and highlight the curative petition, which is a wonderful effort by the Indian government to finally get proper rehabilitation and compensation from Dow and Union Carbide, and also inform people about some of the innovative and wonderful things that survivors are doing on the ground to protect their own communities, since other people are not protecting them. And they have things that they can teach us about how they've leveraged community health workers to reach out into the communities and educate and protect people and help people to protect themselves. Because unfortunately, based on population estimates, Bhopal gas survivors are about 6.5 times more likely to die from COVID-19 than the general population in Bhopal, which of course is terrifying and really highlights the degree to which there is still long-term health injury in that population, which many groups have been saying for a very long time, and we're going to hear more about today. But there is still emerging evidence on that, and it makes it really doubly important for us to think this year about how to make sure to get rehabilitation for them. Most survivors only got a small payment for quote unquote temporary injuries related to the gas disaster based on the initial settlement. And of course, as we can see now very vividly, those were not temporary illnesses, and they continue to haunt people to this day. So I'm really excited to introduce our panel. We're first of all going to hear from Joe Jackson. He's Managing Director at Keltbray Remediation, and he's going to talk to us about what's realistically possible and indeed necessary in order to have a cleanup, a proper cleanup of the contaminated site in Bhopal, which was left and has had very little done since 1984. We're then going to hear about the chronic health injuries of the gas exposed from Dr. Sanjay Srivastava of the Sambhavna Clinic. Next, we're going to hear about how COVID-19 targets the lungs in particular in people with lung injuries and people like gas exposed victims from the Director of Programs and Strategy at the Lung Care Foundation in Delhi, Matrushri Shetty. And then finally, we're going to have a wonderful presentation from a community health worker on the ground in Bhopal about how the community has mobilized to protect people from COVID-19. And of course, we're seeing this elevated and tragic death rate there, but we have actually seen some great effects from the work that's been done locally as well. We're going to hear from Tabasum Arda, and she's going to have a translation from Managing Trustee Satu Sarangai. So I'm really excited to get started. I'd like to introduce Joe Jackson, and maybe he can also give us a little bit about himself, and then we're going to hear about the factory in Bhopal. Joe?
Thanks, Bridget. Good afternoon, good morning, hello, everybody. I'm very pleased to be invited to talk today. My name is Joe Jackson. I've been working in the world of contaminated land and land remediation for approximately 20 years. And I first came to learn of Bhopal through a charitable notice in a broadsheet newspaper, and it seemed like an awful case study of real contaminated land. I went to Bhopal in 2006 and stayed at the Sambhavna Clinic and have been a friend of the survivors group, I guess, ever since. My day job is I'm a remediation professional and I clean up contaminated land in the UK predominantly, but have a reasonable understanding of the international standards. So I'm going to talk today briefly about the ongoing spread of contamination and a roadmap to remediation. So a brief history of the site. Lots of you already know this. The pesticide factory was built in 1970. It operated for nearly 15 years. And at the time, the accepted practices were quite different internationally than what they are now. But even at the time, the accepted practices on site in India were not at the international standard that we would have expected. So there has been historic on-site disposal, shallow burial of waste products, and use in particular of the solar evaporation ponds for effluent treatment. So on the right, you can see the solar evaporation ponds being constructed. Essentially, they consisted a large lagoon with a lightweight liner covering, which was then filled with the effluent. And the intention was that the solar radiation would simply evaporate the problems away. And in fact, the long-term integrity of those structures has been compromised and is a key source of some of the contamination that we're seeing getting into groundwater sources today. There have been multiple light touch ground investigations to date. There's been a lot of work done in very small piecemeal phases, and none of it would be considered sufficient to appropriately characterize the ground conditions at the site. So the next slide here shows the sister plant that was built at around the same time in the United States. This was the South Charleston's waste treatment plant, which received the effluent from the Union Carbide facility in the States that was dealing with a similar process as the facility in Bhopal. And what you can obviously see here is there is a sophisticated and well-engineered effluent treatment multi-stage system that is dealing with these contaminants prior to being discharged to a watercourse, not simply being left for solar evaporation to deal with. So what happened since the disaster? Well, there was no formal decommissioning. The site has not been properly secured. There has been informal access to the site from some of the local communities seeking to obtain building materials or similar. Many raw processed materials and chemicals were simply abandoned. The limited remedial efforts to date has been simply removing some of those source residual contaminants rather than actually doing anything within the ground. And we know there is ongoing environmental damage. The solar evaporation ponds continue to degrade. And in recent years, there's been active consideration to build a memorial to the disaster on the site, which in itself might hamper access to the ground. The ground may, in its own right, be an obstacle to that construction, but certainly it would also potentially hinder investigation or remediation work that might be required. So this is a more global view of what we might expect to see in terms of formal decommissioning of facilities such as this. You can see, you know, a very careful operation being undertaken with high degrees of industrial hygiene, clearing any residual contamination and ensuring safety not just of the operatives, but not really shown here, but of anybody in the surrounding communities as well. And you know, it would be done on a logical and phased approach that would bring us down to something like a flat slab, which we would then seek to further remove and deal with any of the underlying problems. So a very brief whistle-stop tour of contaminated land. We always think about contaminated land in terms of a conceptual site model or a CSM. And at the heart of this is what we call the source pathway receptor pollutant linkage. So essentially, we have a problem where there is a source of contamination, a viable pathway, and a receptor, someone or something that may be impacted by that contamination via a exposure pathway. I think on the next slide, if you would please, we can look specifically at the key source pathway receptor pollutant linkages that we have in Bhopal. We have chemical deposits and the solar evaporation ponds being a, you know, let's not lose sight of the fact that this was a pesticide factory. It made poisons, and that's exactly what the processed chemicals and the byproducts are. And they've been discarded in an uncontrolled manner, relatively uncontrolled manner, which has allowed the toxins and the contamination to seep into the underlying groundwater, which is subsequently abstracted via hand pumps and is used as potable water supply in the local communities. So in terms of the extent of the contamination, what we recognise is that we have a dynamic environment here. Groundwater moves. Groundwater below ground is just like water above ground, it flows, and there are processes of natural dispersion, infiltration, and even pumping causes a impacted plume to move and grow. We don't know a great deal about this. As I say, the site has not been well characterised. So this is a resulting view based on actual impact at the hand pumps. So there are 42 communities that have been recognised as impacted by the Supreme Court, and a further 6 have been since discovered. So that's grown in recent years from 22 up to 48 in total. We don't know what degradation may be happening to these complex chemicals. We don't know if they're degrading into something more mobile, more toxic, and we're not sure what this cocktail may be exposing end users to in terms of synergistic effects. So one contaminant plus another contaminant can sometimes be much more significant. So the roadmap to remediation and recovery from a technical viewpoint we'll start looking at an iterative process whereby we have data gathering and assessment, we define our conceptual site model, we undertake a detailed risk assessment, and we identify what options may be available. We trial those options, we validate, and we take that information and we go round the circle again. So essentially, we're assessing what we know, defining what we don't know, making plans to fill the gap, and then considering the options which we then implement, validate. But there needs to be a constant review and monitoring of the process. And that is really the internationally accepted approach to defining and addressing problems such as this. So what would that look like? Well, we can sample existing wells, and we would need to drill new wells. We'd need to do trial pits and gather soils and water for laboratory analysis. But all of this needs to be carefully targeted and planned by a detailed desktop study. And that would give us information into what process activities are undertaken, where, what are the underlying soil conditions, how can we predict and anticipate where the contaminants may accumulate or where we may intercept them. The non-technical part of the roadmap to recovery, which is equally as important, is that the goals for remediation must be developed in conjunction with the local community. It's not for anybody to come along into this part of the world and say, this is what we're going to do. We can certainly draw upon international expertise and set standards around prevailing health impacts, etc. But in terms of what the goals are, we need to weigh up the various risks associated with dealing this material and the rewards of resolving it in a way that brings in all the stakeholders into the decision-making process. Further investigations and assessment requires funding. The works need to be completed and validated. And my involvement with Bhopal and the survivors group was historically to look at proposals that have been presented in the past and assess their technical suitability for actually achieving the goals in a technical manner. But none of this undermines the polluter pays principle, which is internationally accepted. And one of the goals for the survivors group is clearly justice and making the original polluter pay. So thank you very much. Hopefully that's as brief as it can be, and I'll hand you guys back to Bridget. Thank you.
Thank you so much, Joe. That was really wonderful. And it's great to know that there really is a clear roadmap for what can be done, and survivors don't have to live now in this secondary disaster where we've seen for the past 30 years people living around the plant, mostly survivors, but also people who have just moved there, drinking toxic water and living in this environment. So, you know, the only impediment is making sure that the company that's responsible can pay for this. And it's wonderful to see that certainly the expertise is there, and it does not have to continue this way. So thank you, Joe. Now we're going to hear from Dr. Sanjay Srivastava, who is a doctor at the Sambhavna Clinic in Bhopal, and he's going to talk to us about the long-term health impact of toxic exposure, which, as we noted, is not only this huge injustice issue and cause of enormous suffering, but also is making people more vulnerable to COVID-19. And thank you, Sanjay. Please go ahead.
Thank you, Bridget, and thanks for giving me this platform to share about this effect of methyl isocyanate on long term. I am here at Sambhavna as a physician, and we have OPD patients coming daily to our clinic, and they are 55 to 60 and sometimes more as they come routinely for their checkup and for their treatment. Today in this presentation, I will be focusing mainly on the injuries caused by methyl isocyanate on the long run, and most of them have never been observed and not shared and documented at all. What happened actually immediately after the gas tragedy, the Union Carbide Corporation, they withhold the information about the toxins and the treatment. So nothing was known to the doctors, to the medical officers, to the government, that what type of toxin this is and how we need to deal with it. So whatever the government was doing to the patients was just trial and error. And in this, a lot of casualties happened. And approximately 8,000 people died within 72 hours. And later on, most of the research were carried out by the individual researchers from India, from abroad, and by ICMR, that is Indian Council of Medical Research, and which pointed mainly towards the respiratory involvement of the organs, which are respiratory, ocular, reproductive, neurological, and psychological. But this were only done, this type of researches were done only for 10 years, and then everything is stopped. But then Sambhavna came into existence, and then Sambhavna carried out through its MIS, that is medical information system. We are having a wonderful MIS system at place, and we came out about the findings that majority of the patients which are registered with us are having diabetes mellitus, hypertension, allergic reactions on their bodies. They are having rashes all over the bodies. They are suffering from hyperacidities. Their cancer prevalence is higher in them, and mainly thyroid disorder is very prevalent in our patients, those who come to us. So this was an observation at Sambhavna Trust. Recently, there was there was information at National Medical Library USA, and that information also matches with the findings of the Sambhavna, and that also says that lactic acidosis, which is very common in our patients, hyperglycemia, pointing out towards the diabetes mellitus, which is type 2 diabetes, lung involvement, mainly asthma and COPDs, and allergic exacerbation of the disorders. And now in this COVID phase, as has been informed by previously also, that 6.5 times more COVID patients are there in our gas victims, and pulmonary fibrosis and uremia is very common. So almost the same thing is matching with the findings what we are having. At Sambhavna Clinic, we are very stringent about documenting their body weight, their height, taking their vitals. So we thought to see the data in our patients, and 27,155 individuals were screened, and we started seeing the data from January 2005 till September 2020, and in that whole group we found that BMI is 2.75% times more in gas victims, and this is pointing towards overweightness and obesity. This also indicates that obesity, most of the patients are vulnerable towards other disorders like cancer, and they are more towards hypertension and diabetes 2, type 2 diabetes, coronary attacks, and strokes or osteoarthritis, and anxiety, sleep disorders, mental disorders are very common in our patients. So this high prevalence of in our gas victims of BMI is very high, And then we later on also seen this in our patients that because of this hypothyroidism, and hyperthyroidism is very common. So cancer associated disorders are also very common in overweight and obese patients. Later on, we have seen that the prevalence of thyroid disorder in our patients is also almost double than those who are not suffering from had suffered from the gas tragedy. So it is almost 1.92 times more in the victims, those who had exposed to gases, than the other in the general population. So this was the finding mainly with our Sambhavna Clinic Trust, and hopefully there are more things which we need to explore in coming time regarding which needs to be studied further. So this is all from my side. Thank you.
Thank you so much, Dr. Srivastava. That was very interesting and certainly confirms what we've known and what various medical studies have shown over the years, that all kinds of secondary disorders and chronic diseases seem to be associated with gas exposure. And it's tragic to see that continuing. And now, of course, with the pandemic becoming even more concerning. So to speak specifically to that, I'd now like to introduce Matrishree Shetty from the Programs and Strategy section of the Lung Care Foundation in New Delhi. Matrishree, would you, yeah, there you go. Thank you.
Thank you, Bridget. Warm greetings to everyone present. I'm Matrishree from Lung Care Foundation, and today I shall be talking about the high vulnerability of Bhopal gas survivors to COVID-19. Before I begin, I take this opportunity to sincerely appreciate the amazing work being done by the Bhopal Medical Appeal, Sambhavna Trust Clinic, Chingari, and many other organizations, as well as individuals who have made it their life's mission to help the Bhopal survivors and seek justice. Lives have been permanently altered following the Bhopal gas tragedy, with thousands still suffering from extreme health issues. On top of this, the entire world has been hit by COVID-19, a deadly pandemic that claimed nearly 1.5 million lives worldwide. This brings us to asking some key questions. Even after 36 years, the pain and agony of Bhopal gas tragedy, termed the worst industrial disaster in human history, is still being felt. Can we imagine the long-term impact COVID-19 will have on human body and mind that has affected millions worldwide? Now that the vaccine is going to be available soon, how would this vaccine impact the erstwhile gas-exposed victims? How soon and how effective would the administration of the vaccine be in India, especially in Bhopal? Food for thought for the coming times. Coming to the COVID situation in India, it has been especially difficult since the number of confirmed cases reported in the country are more than 9 million. And with nearly 40,000 cases being added every day, it is still showing an upward trend. The situation in Bhopal is equally grave. Can I have the next slide, please? As on 28th November 2020, Bhopal has recorded 31,333 confirmed COVID-19 cases, with more than 500 people losing their lives to the infection. Next slide. What happens when someone is infected with COVID-19? Information about COVID-19 and its complete impact on human body is still evolving. There is new information being added every day about COVID-19 transmission, symptoms, long-term impact on health, among other things. But here are some facts that we know at present about the infection. COVID-19 is primarily a respiratory disease affecting the lungs. The virus enters the lungs, causing respiratory failure, acute respiratory distress syndrome, and in many cases, pneumonia. It is also known to cause heart, liver, kidney problems, leading to arrhythmias, myocardial injury, stroke, liver and kidney failure. Existing information available based on the analysis of confirmed cases of COVID-19 from around the world has established without a doubt that people with comorbidities like lung diseases, COPD, asthma, heart diseases like hypertension, coronary heart disease, cancer, obesity, diabetes, among others, have a greater risk of severe illness caused by the COVID-19 infection. Next. Does COVID-19 have any link with air pollution? This is another debate that has built up heat in the past few months. There is substantial evidence from the researchers in countries including US, England, Italy, China, Netherlands, and India showing strong correlation in long-term exposure to high levels of air pollution, significantly increasing the risk of COVID-19 infections. Today, I'm going to be talking about 3 such research studies. The first one being a study conducted by Harvard University assessing the link between long-term exposure to PM 2.5 and COVID-19 mortality in the United States, showing a statistically significant evidence that an increase in 1 microgram per cubic meter in long-term PM 2.5 exposure is associated with an 8% increase in COVID-19 mortality rate. Similarly, a study done in England, next slide, to explore the link between air pollution and COVID-19 showed that exposure to gases like nitrogen dioxide, nitrogen oxide, and ozone levels are significant predictors to COVID-19 related deaths. A study conducted in Netherlands to estimate the relationship between long-term exposure to air pollution and COVID-19 cases in 355 municipalities in Netherlands showed statistically significant relation between COVID-19 cases and exposure to PM 2.5, NOx, and SOx. Now, all these researchers show that exposure to pollutants in the air makes us at risk to developing complications due to COVID-19 infections and even may result in death. But what happens to our body when it is exposed to pollutants present in the air? Next slide. Air pollution affects only lungs, our heart, our brain, liver, kidneys, pancreas, etc., etc. So in effect, there is no organ or organ system in the body that does not get affected by air pollution. According to the recently released State of Global Air 2020 report, it is estimated that significant percentage of deaths due to COPD, diabetes, ischemic heart disease, lung cancer, lower respiratory infections, etc., can be attributed to air pollution, with impacts seen even before the birth of a child in the mother's womb. Next slide. Next slide. In the low and middle income group population, excessive use of chulha or the earthen stove by women in the household leads to actually women and children being at a greater risk of COPD and lung cancer. Let me give you a sneak peek inside our lungs to show how it is impacted by the pollutants present in the air. Next. The image in front of you is the actual surgical images of lungs. The one on the left is a normal, healthy pink lung, as it should be in our body. And the one you see on the right is the lung of a young boy exposed to high air pollution levels in a place like Delhi. Let us now look at a specific situation of Bhopal. The graph that you see in front of you is the disease burden data of over 1 million gas victims and dependents seen at 8 health centers of Bhopal Memorial Hospital and Research Center between 1998 and 2016. As is evident, the gas-exposed victims are more prone to respiratory and cardiovascular diseases, amongst others, which is similar to that of the people impacted by long-term exposure to air pollution, as also been highlighted by Dr. Srivastava. Clinical studies have shown chronic illnesses such as pulmonary fibrosis, bronchial asthma, chronic obstructive pulmonary disease, COPD, emphysema, recurrent chest infections, keratotherapy, corneal opacities in gas-exposed cohorts. Next. As per the Health Bulletin of the Department of Health and Family Welfare, Government of Madhya Pradesh, on 15th November 2020, Bhopal district recorded 498 deaths due to COVID-19. Of these, the authorities were able to trace back families of about 450 deceased. Out of that, 254 are those who have proof issued by the government of being gas exposed, which is 56% of the total number of families traceable, which is an incredibly high number. Reviewing all the evidence that I've just presented, it is clear that comorbidities caused due to long-term exposure to air pollution and lifestyle choices pose increased risk for complications in COVID infection. This, coupled with weakened immune system and burden of disease exerted by the chronic exposure to methyl isocyanate gas and other toxins through air and water for years, causing serious health problems, as mentioned, increase the risk on lives of gas-exposed people by 6.5 times, which has been highlighted multiple times during the conversation today. Having talked about the COVID-19 infection, here are 6 steps we recommend as precautions and prevention against COVID-19. I have based these steps on the name of Bhopal, creating an acronym. Be disciplined in wearing a mask. Practice hand hygiene. Observe social distancing. Take immediate and necessary precautions on first signs of COVID-19 infection. Information on COVID-19 is still evolving. It is therefore important to keep asking questions and seek information to keep yourself up to date with the latest developments. Last but not the least, it's important to listen to your doctor and follow their advice. Stay safe for yourself and your loved ones. I would like to sum up my today's presentation with a quote from Dr. Arvind, who is an eminent lung surgeon from India and the founder trustee of Lung Care Foundation. The gas exposure led to a lot of damage to all the systems in the bodies of the gas exposed victims. And worst affected were the lungs, as this was where the gas was inhaled. In addition, they have other systemic diseases, such as heart disease or high blood pressure, and the plethora of diseases affecting them means they are people with reduced immunity. When they get COVID-19, they are then likely to have a higher chance of mortality due to this compromised immune system. This brings me to the end of my presentation today, where I talked about the COVID-19 disease, its long-term impact on health, and increased vulnerability of gas-exposed victims to the COVID-19 infection, also raising some eminent questions that we all are yet to receive answers in the coming few months. Thank you.
Thank you so much, Matrushi. That was fantastic. And it really connected the dots for us between what we heard about in terms of air and water pollution from the site from Joe Jackson, and also the vulnerabilities to health from Dr. Srivastava. So now we're going to hear from a community health worker at Chingari and Sambhavna clinics, Tabassum Ara. Tabassum ji, आपका स्वागत है. आपकी presentation शुरू कीजिए. Tabassum.
शुक्रिया.
थैंक यू ब्रिजिट, शुक्रिया मुझे वेबिनार से जोड़ने के लिए. मैं जो बस्ती में समुदाय में जो काम किए गए कोविड-19 को रोकने के लिए वो बताऊंगी। संभावना ट्रस्ट के लिए हमें पहले पुराना काम अपना बताऊंगी थोड़ा सा।
Hello, Bridget. My name is Sumara, and I will speak on how the work of Sambhavna and Chingari, a community-based work to confront the COVID pandemic. I'm going to first talk about the community health work that we have been carrying all these years.
संभावना से हम 7 स्वास्थ्य कार्यकर्ता हर दिन यूनान कार्बाइड पीड़ितों की बस्ती में जाते हैं और उनका स्वास्थ्य में बेहतरी हो उसके लिए अलग-अलग तरह की गतिविधियां करते हैं।
From Sambhavna, in Sambhavna there are 7 community health workers who visit communities every day and take steps to improve the health of the community. क्या करते हैं? नहीं, ये सब करते हैं।
हम लोगों को स्वास्थ्य शिक्षा देते हैं, बीमारियों पर वॉलंटियर जो समुदाय में जोड़े हैं उनका प्रशिक्षण करते हैं। बस्ती में कुछ सरल जांचें होती हैं जैसे ब्लड प्रेशर लेना, वजन, ऊंचाई करना, खून की कमी की जांच करना। छोटे-छोटे अध्ययन भी उनकी बीमारियों पर किए जाते हैं। जड़ी बूटियों के बगीचे भी बस्तियों में लगाएं ताकि लोग कहीं से अपना इलाज ले सकें।
We carry out health education. We identify and train members of the community to become health volunteers. Also, we encourage them to grow herbal gardens in their communities. We try and generate information, health information in the community itself, and we carry out, along with the community and the health volunteers, we carry out programs to either reduce or eliminate health problems such as malaria and TB. All this was before the pandemic struck. Next slide, please. Yeah.
ये वो इलाका है जहां हम काम करते हैं। यूनियन कार्बाइड फैक्ट्री से लगभग 3 किलोमीटर आसपास के एरिया में हम काम करते हैं जहां की ज्यादातर निम्न आर्थिक स्थिति के लोग रहते हैं और कार्बाइड फैक्ट्री पीड़ित है।
We work, this is the area where we work and where we have worked in confronting the pandemic. This is within about 3 kilometers from the Union Carbide factory, which you can see on the left. And most of the people here, overwhelming majority of people here are from low-income families. Next slide, please.
जब WHO ने कोविड-19 को महामारी घोषित किया गया तो हम लोग ने सोचा कि गैस पीड़ितों को इससे ज्यादा खतरा हो सकता है तो किस तरीके से हमें काम करना चाहिए उनको बचाने के लिए, पहले से क्या कदम उठाना चाहिए। तो इसके लिए चिंगारी ट्रस्ट, संभावना ट्रस्ट और हमारे जो हेल्थ वॉलंटियर्स हैं जो पहले से बनाए हुए लगभग 85 उनके साथ में संभावना क्लिनिक में मीटिंग की गई और तय किया गया कि हम किन किन मुद्दों के तहत काम करेंगे, किस तरीके से करेंगे, किस जिम्मेदारियां क्या होंगी लोगों की और निगरानी उन पर किस तरह की जाएगी।
Soon after the pandemic was announced in India, there were reports coming out which showed that people in Bhopal are likely to be more vulnerable to getting infected. So we called a meeting of our community health volunteers with staff of Chingari Rehabilitation Center, and together in this meeting we decided on what were the issues that we will work on, who will take responsibility of what, and how the entire work would be monitored.
कार्य योजना तय हुई जिसमें कि 7 मुख्य मुद्दे तय हुए जिनके तहत हमें काम करना था, जिनके बारे में मैं अगली स्लाइड में बताऊंगी।
We basically decided to work on 7 action points, and I will talk about them. I will talk about them in the next slides. Yeah.
Next. ये है कि कोविड-19 के लिए लोगों को किस तरीके से अवेयर किया जाए क्योंकि ये बीमारी नई थी और लोगों के मन में इससे के प्रति डर भी बहुत था और भ्रम भी बहुत था। तो हम लोगों ने 80 बस्तियों में जो कि गैस पीड़ित प्रदूषित भूजल पीड़ित थी ऐसी 80 बस्तियों में लगभग 25,000 संख्या में पोस्टर, बैनर, पेम्फलेट्स वगैरह छापे और उनमें इस तरह की जानकारी कि वायरस क्या होता है, वायरस शरीर में जाएगा तो क्या लक्षण हो सकते हैं, बीमारी से हम कैसे बच सकते हैं, सही इलाज कहाँ ले सकते हैं, जांच कहाँ करवा सकते हैं, इस तरह की जानकारी वाले पोस्टर्स हमने लगभग 25,000 छपवाए और 80 बस्तियों में बांटे।
we realized that this was a situation, this was an unprecedented situation, that people and nobody had enough information about the pandemic. There was general confusion. So we decided that the first thing to do would be to spread awareness, get proper information, and tell people what a virus was, what a virus is, how it attacks, and what are the symptoms that are caused, and what kind of precautions need to be taken. So we distributed leaflets, with information leaflets, in 80 communities. About 25,000 leaflets were distributed. We put up banners, posters in the different communities and tried out. And also we set up WhatsApp groups with almost 14,000 members, and did our best to spread reliable information, reliable and correct information on the virus and its effects.
हम लोगों ने टीपी टेप भी बनाए और उनके मॉडल भी बनाए। कई बस्तियों में जहां हम लोग को जगह मिली वहां टीपी टेप लगाए गए और बस्ती के लोगों ने उनका काफी उपयोग किया। इसके अलावा मॉडल बना के उसके जगह-जगह 80 बस्तियों में घुमाए गए कि जहां-जहां भी जगह हो लोग उससे बनाए और इस्तेमाल करें, और ये काफी सक्सेसफुल रहा।
We also built these tippy taps where you could wash hands without touching. You press a lever with your foot, and we built them inside communities, and also carried models of these to different areas where people could learn from them and build themselves. And this was quite successful in several communities. Next slide, please.
लोगों को लगा जो लोग पहले से पता था कि जो लोग जिनको थायराइड है, ब्लड प्रेशर है, डायबिटीज है और 60 साल से उम्र के जो लोग हैं, इस तरह के लोगों को कोविड-19 का खतरा ज्यादा रहेगा। तो उन लोगों को छांटने के लिए कि हमारे बीच उनकी लिस्ट हो, सर्वे किया गया बस्तियों में, और सर्वे में 1050 ऐसे लोग आए। 3000 परिवारों के सर्वे में 1050 ऐसे लोग आए जो कि हाई रिस्क में थे, और इनकी विशेष निगरानी करी गई और अभी भी की जा रही है, और इनको बराबर दवा मिलती रही। संभावना टेस्ट क्लिनिक से घर पहुंच सेवा भी हम लोग ने की, और ये काम अभी भी जारी है।
The second thing that we did was we said that there was need to identify people who are at risk. Already there was information that co-morbidities make one vulnerable. So we carried out a survey of 3,000 families, from which 1,050 individuals were found to be at high risk. And we paid special attention to them, provided them protection, and also saw to it that they got medicines in their homes. Next slide.
गर्भवती लोगों के मन में इस बीमारी के लिए डर था, क्योंकि नई बीमारी थी, लोग वायरस से बहुत डरे हुए थे। तो उसकी वजह से कुछ सिम्टम वाले लोग भी जाके जांच से डरे हुए थे। लोग जांच नहीं करवाना चाहते थे, सिम्टम भी थे तो घर में रह के उन्हें छुपा रहे थे। तो इस डर को खत्म करने के लिए हम लोग ने काउंसलिंग की, वॉलंटियर की इसमें मदद ली गई। लोगों का ये सोचा गया कि उनका डर वही लोग खत्म कर सकते हैं जिन्हें वो लोग पहचानते हैं, जिन पे विश्वास करते हैं। तो बस्ती के ऐसे लोग तैयार किए गए जो कि बेहतर तरीके से उनकी काउंसलिंग कर सकते हैं, तो उनके जरिए करवाई गई। और हेल्थ केयर वर्कर को भी वो जानते थे, काफी समय से वॉलंटियर्स को जानते थे, तो हम लोग ने उनकी काउंसलिंग करके डर समाप्त किया।
One of the big problems that we faced was we found there were a lot of people were very afraid. They did not know about this disease, and they were also afraid of getting themselves tested. So what was happening was many people were hiding, even if they had symptoms that could be COVID, but they were hiding. So we realized that that was one of the first social issues that needed to be tackled. Along with ourselves, we also identified people in the communities whom their neighbors trusted. And through people in the community, we carried out counseling on a large scale to bring down this fear and to encourage people to come out and get tested if they had any symptoms. Next slide, please. Screening of testing.
जो हाई रिस्क में लोग थे 1050, उनकी जांच होना जरूरी थी, लेकिन लोग जांच के लिए कतरा रहे थे, जाना नहीं चाह रहे थे। तो हम लोग ने उनकी बस्तियों में ही कैंप लगवाए, और वहाँ कैंप में शुरू में स्टाफ के लोगों ने भी जांच करवाई, वॉलंटियर्स ने करवाई, ताकि उनका डर खत्म हो। फिर जो लोग डर देखने के बाद में लोग आए, फिर उन्होंने अपनी जांच करवाई, और हम इसमें से 813 लोगों की जांच हुई और उसमें से 33 लोग पॉजिटिव आए, उनका इलाज करवाया, लोग ठीक हुए।
So we went around screening people for whether they had any symptoms. We used thermal sensors and pulse oximetry, but at the same time we encouraged people who were in high risk and to get themselves tested. They were scared to go to the hospitals oftentimes, so we organized camps within the communities and we got people tested, out of whom 33 tested positive in RT-PCR.
पिछले 8 महीने
Next slide, please.
जो लोग डर की वजह से घर में रुके थे, दवाई लेने नहीं आ रहे थे, ऐसे लोगों को भी लगातार संभावना की तरफ से घर घर में दवाई दी गई और आम तकलीफ कोविड-19 के साथ साथ आम तकलीफों के लिए भी लोगों को आयुर्वेदिक, एलोपैथिक और जड़ी बूटी द्वारा इलाज उनकी बस्ती में ही मुहैया कराया गया।
So we reached medicines to people in the communities. Also, we of course dispense medicines to people who visited the Sambhavna clinic. We tried to balance attention to COVID-19, potentially COVID-19 cases, and also a whole lot of non-COVID people who required treatment for their chronic diseases. Next slide, please.
बस्ती में कम जगह होती है और ये बीमारी के लिए सब महसूस था कि शायद आगे जब ज़्यादा बढ़ जाए तो सरकारी अस्पतालों में जगह ना मिल पाए लोगों को इलाज के लिए, तो पहले से ही हम लोगों ने बस्ती में होम क्वारंटाइन और होम आइसोलेशन की व्यवस्था करवाई। वहाँ जो स्कूल, धर्मशाला थी वहाँ पर हम लोग ने जगह की पहले से व्यवस्था करी ताकि ज़रूरत पड़ने पर लोग क्वारंटाइन हो, होम आइसोलेट हो और 5 लोगों को बस्ती में ही होम आइसोलेट किया और वो ठीक भी हुए।
We realized that because a large majority of people who were living in the area where we work, they had one-room dwellings where it would be impossible to isolate an individual from their family. So we looked for community quarantine places, and we facilitated quarantining in different communities. Next slide, please.
लॉकडाउन के समय लोगों के रोजगार चले गए थे और काफी आर्थिक तंगी से गुजर रहे थे, कुछ घरों में खाने के लिए भी सामान नहीं था, तो ऐसे घरों की स्वयं सेवकों के साथ पहचान की गई और उन्हें आवश्यकता अनुसार पका हुआ खाना और कच्चा हुआ राशन दोनों तरह की चीजें उपलब्ध कराई गई।
Because a large section of the people we worked with were daily wage labor, they lost their livelihood because of the lockdown as a result of the pandemic, and so there were families that were literally starving. So we identified such families, and with the help of local volunteers, we saw to it that people who in need got cooked and uncooked food. Next slide, please.
हमारी कोशिशों का नतीजा ये हुआ कि 42,000 की आबादी में सिर्फ 2 ही लोग ऐसे हुए जो कोरोना के कारण खत्म हो गए, बाकी जो लोग बीमार हुए थे सब ठीक हुए। और हमारे वॉलंटियर जो काम हमने 85 वॉलंटियरों के साथ शुरू किया था, आगे बढ़कर दुगने हो गए, वो 180 हो गए। शुरू में हमने 15 बस्तियों में काम किया था, हम काम से प्रोत्साहित होकर वॉलंटियर के साथ में नई 10 बस्तियों में और हमने इस काम को जोड़ दिया है। साथ ही 14,000 जो व्हाट्सएप ग्रुप में जुड़े थे उनके जरिए जानकारी और लोगों को भी फैलाई जा रही है, तो एक बड़े पैमाने पे ये काम शुरू हो गया है।
So the impact of our work is that in a population of 42,000, we had 2 deaths due to COVID, and most others did not were taken care of and they got well. In the beginning, when we started, we had 85 community health volunteers and we were working in 15 communities. Today, 8 months later, we have 180 community health volunteers and we are today working in 25 communities. Also, we find very encouraging questions and responses from many of our members of our WhatsApp group. So the WhatsApp group keeps spreading the latest information on the pandemic and making people aware of the precautions they need to take and how they could conduct themselves safely. Thank you.
Thank you.
क्या बात है, बहुत अच्छा, बहुत शुक्रिया तबस्सुम जी. Thank you. That was really, really wonderful. And, you know, I think it's amazing to see how, despite this increased vulnerability, really the community health workers working in Bhopal and that community has come together to have really what's frankly a pretty cutting edge COVID-19 response and able to kind of support the community in that way. So that's really amazing. Thank you so much. So now we're going to open it up for some question and answer. If you have questions, you can put them in the chat and we will try to get to them in the time that we have remaining. Before we do that, I just wanted to wrap up a little bit here. You know, this has been a really amazing opportunity for everyone to come together and for us to connect, see what's going on the ground, understand the science a bit better, and understand how the injustice of the Bhopal gas disaster and the corporate negligence in particular still has lasting consequences 36 years later, and how the community is still coming together to try to support them on the ground, but how much more could be done with proper funding, especially in terms of remediation of the site, and then the ongoing needs in terms of the pandemic now, which is really highlighting what we sort of already knew about the gas exposed population and the effect of the disaster on Bhopal, but which now is coming into relief. So as we wrap up here, before we get to the questions, I really want to thank the BMA for putting this together, the Bhopal Medical Appeal. As you can see on this slide, we very much need support. You can go to the GoFundMe link here, which will help to fund these specific COVID-19 targeted efforts, which are really evidence-based and sound and making a huge impact on this vulnerable community in Bhopal. So if you can go there and give any kind of donation, that would be amazing. While you're there, you can download From Bhopal with Love, which is a bonus if you support the campaign there. And certainly you can always email the Bhopal Medical Appeal at the admin email here. So that's all I have for the main content of the webinar. We still have our panel here, Joe Jackson, Matrushi, Tabassum, and Satu, and hopefully Dr. Srivastava as well. So I'm going to just begin with a few questions. So for Joe, I have a question for you. How usual is it in your experience for contamination to have spread so widely and so far from the source as it has in Bhopal? Is this just because it has been there for so long, and what additional challenges does it create for investigation and remediation?
That's a great question. The answer is that different contaminants have different mobilities, and the underlying geology and the groundwater movement all play a part in how far and wide some contaminants will move. So it's not unusual, I say it's not unusual, it's quite possible for contamination to spread literally for miles if it's mobile enough. I think the unique situation we have at Bhopal is that rather than understanding what the source looks like and predicting where the contamination might be, we very unfortunately have empirical data showing that this has turned up at the receptor. So we don't know how far exactly it's spread. We know that it has been at levels which are readily recognizable because they are instantly recognizable from anybody that's drinking from one of these contaminated standpipes. But again, we may expect that there may be contaminants without taste or smell that may have spread even further. So it is not that unusual in the world of contaminated land for contamination to spread. It is unacceptable for it to have spread as far as it has done over the time period, because obviously this has been going on for more than 36 years and hasn't been contained or managed, and it will continue to spread. And what we don't understand, precisely because we don't understand the cocktail that's in the ground, we don't understand how much further it's going to go, or indeed what's going to happen to the nature of the contaminants as they travel through the subsurface environment. The challenges it represents are significant because, to coin a phrase, it's very difficult to put the toothpaste back in the tube. Stopping this from ever leaving would have been a lot easier than trying to resolve the situation that we have on our hands today.
Thank you, Joe. That's very interesting, and of course it's unfortunate that it's gotten to this point. So thank you for everything you've contributed. I have a question for Tabassum. What has been the biggest challenges you've encountered in the community work on COVID-19, and how has it changed the relationship with the community in Bhopal of survivors? Satu, are you still there? Can you translate that? I think you guys are muted. You guys are on mute.
Yeah.
पॉजिटिव आने के बाद में उनका पूरा दिमाग ही चेंज हो गया था काफी कुछ उन लोग, क्योंकि जैसे हम लोगों ने कैंप करवाया उसके जस्ट 1-2 दिन पहले सरकार की गाइडलाइन अलग थी कि अगर कोई पॉजिटिव आता है तो वो होम क्वारंटाइन और होम आइसोलेट हो सकता है अगर एसिम्प्टोमेटिक है। लेकिन कैंप के अगले दिन ही गाइडलाइन चेंज हो गई सरकार की और ये हुआ कि परिवार वाले क्वारंटाइन होंगे अलग जगह और जो पॉजिटिव है उसको अलग जगह आइसोलेट करेंगे। तो जब लोगों को ये इस दौर से गुजरना पड़ा कि उनका परिवार कहीं और गया और वो कहीं और गए, काफी दूर थे ये सेंटर, तो उस टाइम पे फिर लोग बहुत लड़े, पुलिस रिपोर्ट तक की धमकी दी। उन लोगों ने जो बहुत अच्छे से जानते पहचानते थे, जिनसे बहुत अच्छा व्यवहार बना था और उनसे उम्मीद नहीं थी कि वो ऐसा करेंगे, तो बहुत लड़े वो लोग से।
She says that when we started encouraging people to get tested, they came forth after some talking to, but at that time the government's policy was that anyone asymptomatic people but tested positive could go for home isolation or home quarantine. But what happened was, after people got tested and some of them tested positive, by that time the government's standard operating procedure had changed. And the plan was that the family would be shifted somewhere else and the person who had tested positive would be taken to another location. So which made people angry with us because we were the ones who got them tested. And this became a big issue. Some of them started arguing with us. But again, through help with the community health volunteers, these were taken care of and we moved on.
Thank you, Tabassum. That's really interesting. And that's obviously a challenge for these public health campaigns anywhere in the world. And I'm sure it's doubly difficult for you guys there. And it sounds like you're managing it really well, mainly because you have such a strong relationship with the community already. So thank you. I have a question for Matrashri, if you're available there. So the question is, given the much higher number of COVID deaths among gas survivors due to these multiple comorbidities, do you think as a professional that there are implications for the pending curative petition on Bhopal, which still presumes that 93% of the survivors suffered temporary injuries?
I think it is absolutely, absolutely incorrect to presume that 93% of only 93%. So I was just suffered the temporary injuries and there was no permanent damage done. It's like when we talk about the air pollution scenario, we said there is no death report that states that a person died due to air pollution. So that's the argument that has often been put up when we talk about the health impact of air pollution on people. It's very similar to that. So the effect that there is enough evidence that's available. I've shown you in the presentation that has I've shared today, and also the data that Sambhavna has been collecting over the years. I mean, there is no dearth of information in terms of numbers available to say that the damage has been permanent, and it's still happening. And the biggest proof is that in spite of having now past 3 decades since the incident, there are still cases of people being affected. I mean, these are people, I mean, those who were there at the time of the gas leak have been impacted, are still suffering, but that impact is being seen in the generation and generation after that. So I think there is no question about the damage being very permanent and very going through the generations. It's going to have that kind of an impact. So it has this kind of an information is a very big add-on to petitions fighting for Bhopal survivors justice. And I think whatever we need to do in terms of getting numbers, and also be open to seeing the reality at the grassroots level, is very, very important before just focusing on numbers when considering these kind of petitions. And that's an appeal that I think all of us should have with our legal system.
Thank you so much, Mashushi. Really appreciate that's a very interesting and comprehensive answer to that question. I have a question for Dr. Srivastava. Someone is asking about what treatments are being given or being recommended if people do test positive for COVID in Bhopal if they're gas survivors.
Actually, those who are positive, they are shifted to certain identified hospitals for further treatment. First thing which is measured there is after investigation and after testing of them, their saturation level is monitored very closely. And if the saturation goes down, then they are put on oxygen support. That is the main therapy. Along with that, certain other therapies are provided, which are mostly symptomatic. If they are provided some vitamins, they are provided with some antibiotics as prophylaxis, and then in this way. If certain damage is there, if organ involvement is there, then support is given to that organ. For example, if kidney is compromised, then kidney support is given. Maybe patient may be put on dialysis also. If the patient has some cardiac problem, then cardiac support is given to them. If lung is compromised and the patient saturation falls down, then initially they support it through external support, and if it is not managed, then they intubate the case and put on ventilators. In this way, continuous care is provided to the patients, and gradually, if the condition improves, then they are weaned off from the support system and sent back to their homes.
Thank you so much. And just a final question, maybe for Tabassum or Satu. Someone is asking, can we help by writing to Dow's website to ask them to accept responsibility for cleaning up the pollution left behind by Union Carbide?
Can you repeat that question, please? Sorry.
Can we help by writing to Dow's website to ask them to accept responsibility for cleaning up the pollution left behind by Union Carbide in Bhopal?
Yes, for sure. Definitely. I think if there are a lot of people writing, that will show them that because what they care about is their image. What Dow, we know that Dow cares about its image, because it's linked with how it is seen all over the world. So it will definitely help to remind Dow that there is this responsibility that they have been running away from since 2001, when they took over Union Carbide and took over their civil, criminal, and environmental liabilities.
Great, thank you so much. Thank you, everyone. Thank you to our panelists, Joe, Dr. Srivastava, Tabassum, and Satu. And thank you to the BMA for organizing this. Thank you to everyone for your excellent questions. It's really been amazing. And again, you can support the COVID-19 efforts at the GoFundMe link on this page. And I really appreciate all of you for being with us today. I'm going to close it out. Thank you so much.
Thank you.
Thank you, Bridget.